This year's recipient is a high school senior at Kings Fork High School, enrolled in the Emergency Medical Technology program at the Prudence Center. His current academic standing includes a 4.0 GPA for the program and perfect attendance. He was selected by the school administration to the Governor's School First Academy for Health Careers. He was also selected by his peers to represent them as a class officer and selected by his teacher to the position of team leader. As team leader, he is responsible for working with struggling students to develop and improve their skills in preparation for state testing. This year's outstanding contribution to EMS by a high school senior and $1,000 scholarship is awarded to Simon Reeder.
I'm in the EMT class and I'm going on to be a paramedic, and I've been running rescue squad for a year. Yes.
Rewarding for you?
Oh yes, I love every minute of it.
For Simon, his regional award takes on new meaning in that his nomination goes up against 10 others at the state level for a $5,000 scholarship. So good luck to you, Simon. This year's recipient coordinates a variety of special projects for his department. He works with the Public Access Defibrillation Team and has been responsible for the implementation of public access defibrillation programs in the Naval Station Commissary and Naval Exchange Mall in the past year. In implementing these programs, he assisted the users in developing their facility response plans, facilitated their training, and installed the defibrillators. He has also been instrumental in a Chief of Naval Operations project aimed at preventing suicide among military members. He has performed research, prepared learning objectives, prepared draft leave-behind information brochures for patient refusals, and provided other coordination work for this project, which will culminate with the production of a responder training video and instructor package this summer. This year's recipient reflects the true sense of professionalism, passion, and dedication in his provision of EMS, and congratulations to this year's outstanding EMS provider, Michael Pelise.
I just recommend that anybody that wants to get in the EMS field definitely should at least take a chance and see if they like it and come out. It's a very, very rewarding experience all around.
Our next category, named after Bruce Edwards, who is one of the folks in the line here, who is on the Thames Board and Executive Committee, is the EMS Administrator Award. This award recognizes outstanding leadership and management qualities for EMS personnel at all levels that have supervisory or administrative duties. Serving as chief of the organization for 3 terms, he has stirred his organization through many new initiatives. One initiative, the squad's monthly newsletter, has become an anticipated source of communication and appreciation for organizational members. He always is a source of ideas and encouragement for his members. Outstanding EMS Administrator with the Virginia Beach Volunteer Rescue Squad, Tom Harp.
Well, it actually is recognition for all the hard work and the hours that I put in running our rescue squad in Virginia Beach, and also the work that I do on behalf of the whole system.
An important aspect in EMS is the preparation and care for our youngest patients. The outstanding contribution to EMS for Children recognizes an individual or organization for services that cover any part of the continuum of care for children, from injury stabilization to EMS care to emergency department care, hospitalization, and rehab. This year's recipient has demonstrated a long-standing commitment in improving EMS for children over the past several years, pursuing improvements in EMS care for pediatric patients and striving to continuously improve pediatric safety and pediatric injury prevention. To this end, she has been instrumental in helping organize and instruct numerous pediatric courses, for EMS providers and nurses in order to allow these individuals to develop skills and feel more comfortable in caring for pediatric patients. Congratulations to this year's winner of the 2011 Outstanding Contribution to EMS for Children, Kathy Fox, Centera Lee Hospital. Kathy's unable to be with us today, so accepting on her behalf is Tony Higgins. Thank you, Tony.
One of the most dedicated RNs that I know. Very proud to have her as part of the Tidewater ENA. I was very proud to accept the award for her today.
The Outstanding Emergency Nurse Award recognizes outstanding dedication and service in the field of nursing, knowledge and performance of EMS nursing skills, and cooperative, positive interaction with EMS personnel. Our winner this year is described as having personified unsurpassed leadership and educator qualities, as well as an unparalleled treatment skills as a nurse. Simply stated, she has the qualities every nurse should possess. Congratulations to this year's Outstanding Emergency Nurse Award recipient, Denise Bayless, Centera Nightingale Air Ambulance.
I'm very honored. The fact that my peers were the ones that nominated me, I'm very honored by that.
The Frank M. Yiser Outstanding EMS Physician Award is given to an operational medical director who demonstrates outstanding leadership and dedication in the exercise of medical control in a local or regional EMS system. For the past decade, this OMD has ensured that the members of the entire EMS system provide the very best in pediatric pre-hospital care. This physician is more than an OMD on paper. She is a true participant in the decision-making process of the region. During her tenure and involvement with EMS, she has been instrumental in the implementation of initiatives that benefit EMS, including frequent regional pediatric continuing education courses, input into the regional protocol process, and input and research into EMS prevention programs aimed at the safety and well-being of pediatric patients. Congratulations to the OMD for the Children's Hospital of the King's Daughters Transport Team, Dr. Teresa Gins.
I was asked by the transport team to become their operational medical director in the past year as they wanted input from one of the emergency room physicians, because our transport team does thousands of transports every year, and one of the emergency room physicians was not involved. And I've always expressed an interest in EMS, and I'm the medical director for the EMS for Children program. So it seemed a natural fit, and I was happy to accept.
The Outstanding EMS Agency Award is presented to an agency that exemplifies outstanding professionalism and service to its community, whose high level of patient care is evident by training programs, community awareness programs, preventative health programs, and participation at the local, regional, and state EMS level. The agency selected as this year's Outstanding EMS Agency exemplifies outstanding service and professionalism during every aspect of its interaction with the community. This agency has created a diversified and robust system which incorporates multiple programs in training, community awareness, and preventative health. Congratulations to this year's Outstanding EMS Agency, Chesapeake Fire Department. And I believe accepting the award is Chief Ed Elliott.
It means to me that we have about 450 people that have been working hard this year, working together this year. They won the award, the fire chief shows up to pick up the award, and we're proud of every one of them.
The James N. Wagenbach EMS Instructor Award is awarded to an EMS instructor who exemplifies outstanding teaching and leadership qualities, who demonstrates a dedication to the education of pre-hospital providers. To know this year's winner, you have to know her impact. This year's recipient consistently excels in instructing and managing EMS education programs throughout the region and the state and the nation. Her commitment to EMS education extends far and above what is normally expected. Her dedication to EMS education is reflected in her work with Tidewater Community College's EMS program as a clinical and field coordinator, her instruction with the Tidewater Center for Life Support, her position as training officer with Virginia DMAT and the National Disaster Medical System, and her volunteer work as an educator with Operation Smile. She is a true advocate for EMS in Virginia. Congratulations to this year's outstanding EMS instructor, Shamara Boone.
Once you actually become a part of the EMS family, you build a new family from your extended family. And these are people that are more, used to what you're going through in life and, the calls that you attend and the people that you're around. The people that you're building or the people that you run with have a better understanding of what you go through, and it's like an extension. So these are people that you can always rely on. So I would say if there's something you consider or maybe kind of waver back and forth, you should consider doing it without a doubt.
The outstanding EMS call category recognizes an EMS call that demonstrates mutual aid, integration of multiple system components, interagency cooperation, or a complex assessment or rescue. On Sunday, July 11th, 2010, a Priority 1 motor vehicle accident with a possible pin on General Booth Boulevard was dispatched. The first of multiple updates received from passerbys indicated that a vehicle had flipped and there were multiple patients. 14 unique pieces of apparatus, both fire and EMS, were dispatched to the scene. One patient had self-extricated and 3 others remained pinned in the vehicle. Engine 12 was the first on scene and immediately advised all incoming personnel regarding the number of patients, confirmed the pins, and upgraded the call to entrapment and established command. Moments later, EMS 6 arrived on the scene and took command from the Engine 12 captain. All 4 patients were successfully extricated 32 minutes after the first call to 911. There were 3 seamless transfers of command and communications and cooperation at all levels, which was critical to the success of this call. One of the 4 patients had not been expected to survive, but did survive thanks to the excellent work of these crews and is on his way to recovery. This call was a true emergency response system example, working together seamlessly to obtain the goal of life safety. With this call, this year's Call of the Year award category goes to the Virginia Beach Emergency Response System, which includes EMS, fire, police, and communications, and accepting the award on behalf of Virginia Beach ERS is John Bianco.
The City of Virginia Beach Department of EMS is recognized by council to coordinate the EMS system throughout the entire city. That involves, as what I said, the Emergency Communications and Citizen Services Department, which are the call takers, 911 telecommunicators. It also involves the police department, who are all trained as first responders, CPR response, and they have AEDs in the majority of their police cars. Also involves the fire department for both BLS and ALS first response out there, basic life support, advanced life support, first response. And then finally the department, the career medics, and then the volunteer rescue squads, the 10 volunteer rescue squads and 1 volunteer marine rescue team within the city that all respond at the appropriate depth for the call type and the nature of the injury or the illness or the rescue call.
Our first award, which is a new award category this year, is given to an individual, program, business, or licensed EMS agency that has demonstrated comprehensive or significant accomplishments in programs that make a significant contribution or provide for the health, safety, and welfare of our EMS providers. This year's recipient has drafted and carried through to adoption an Emergency Nurses Association national resolution supporting efforts against hospital shopping. Hospital shopping is the practice of calling multiple air ambulance programs for a mission when others have refused it due to poor weather. This practice has been cited as a contributing factor in numerous fatal helicopter accidents. Her efforts to put this at the forefront of the Emergency Nurses Association has helped spread awareness and education against this potentially hazardous practice. Our recipient of the Council's first Outstanding Contribution to EMS Health and Safety Award goes to Janice McKay.
Last year I went to San Antonio for a national conference and presented to 700 in a General Assembly to encourage ENA to work with the air medical programs, international flight paramedic agencies, air medical systems to educate nurses and EMS about the practice so that way we can decrease some of our air medical crashes.
Our final and most cherished category is the R.C. Daly Award for Excellence in Emergency Medical Services. This award was established in honor of longtime Thames Associate Executive Director R.C. Flash Daly to recognize an individual who exemplifies outstanding dedication and services to the local, regional, or state EMS system and who has demonstrated a commitment to a comprehensive, integrated EMS system. A well-deserved congratulations to our 2011 recipient of the Robertson C. Daly Award for Excellence, Bruce A. Nedelka.
After being involved in EMS as a volunteer and in career for so many years, it's an extremely rewarding thing to be nominated and selected by your peers to receive such a high honor.
I got the Outstanding Contribution to EMS Safety and Health.
Explain that program.
This is actually a new award this year, and I kind of got nominated because of my activity with Emergency Nurses Association, and back in 2006 the FAA identified that air medical crashes, one of the contributing factors was helicopter shopping, and seeing that in my daily practice because I'm a flight nurse, I made it my passion because I didn't see many people go out and educate an EMS or nurses about the practice and the consequences that it has on our program. So last year I went to San Antonio for a national conference and presented to 700 in a General Assembly to encourage ENA to work with the air medical programs, international flight paramedic agencies, air medical systems to educate nurses and EMS about the practice so that way we can decrease some of our air medical crashes.